Welcome everyone to TFC Talks. I am Amanda Davison, a licensed marriage and family therapist, and your host today as we talk about a really crucial topic, mental health awareness. I have my guest here, Renee Singletary, and I am so excited to be able to talk with you today, Renee, because I know this particular topic, mental health awareness, is something that is so near and dear to your heart. And I'm excited for all of our listeners and viewers to be able to get a chance to hear a little bit about your heart. While I say that, I just want to say welcome to your first grown-up conversation. In the last 6 weeks, you said that you just had a baby, and so coming in and recording with me right after having a baby to talk about such an important topic, I can't thank you enough, and I am really excited to just advocate for what's going on in mental health and also just hear where you're at and where some of that journey is. So thank you for joining us today.
Thank you for having me.
Super excited. So let's kind of get into the topic about kind of why mental health awareness matters. And so there are a couple things that we want to talk about here. Let me just start by getting your heart. Why does mental health awareness matter to you?
So I wanted to be a social worker because when I was a senior in high school, I had a friend who committed suicide. And he experienced a lot of bullying. He was also part of the LGBT community, and he didn't seek out services, and the impact that his death had on me really impacted the trajectory of my, senior year to the point where I had social workers assigned to me to kind of help me get through the last couple months so I could seek graduation. And so that impact that they had on me, I wanted to be able to return that and make sure that nobody felt like they were alone in this and that was their only option.
I'm so sorry that you went through that, Renee. What a challenging and difficult experience to watch somebody so close to you struggle, and then from that struggle watch that the only option that they really felt they had at that moment was suicide, and then to deal with the aftermath of that. And what an incredible testament to who you are to take that tragedy and turn it into a testimony where you're able to be that person that walks alongside somebody else.
Thank you.
So there are a couple things in that story that really stick out to me, and I know that you and I have had some conversations on the back end about why mental health matters. And one of the things that we've talked a lot about is stigma, and how much stigma there is associated with mental health. Can you tell me a little bit about how you've seen that stigma kind of play out and why addressing stigma is so important to you?
Well, when I even think about the loss that I experienced, you would think your parents would be your number one support to go through that kind of experience. But my parents came from an upbringing and culture where that was viewed in a negative light, and grieving him wasn't something that was encouraged. Same thing with being in services. It wasn't something my parents really understood at the time. So anytime we talked about depression, anxiety, grief, it was dismissed and minimized. They're better now that I've kind of have educated them and shown them the reasons why mental health is so important and why we need to challenge some of that taboo stigma that comes with at least my culture and our upbringing.
Yeah, I love that you bring up culture and how much culture plays a part in that, right? And part of that stigma comes from lived experience, right? We just don't know what we don't know. And we really have come from a generation where our problems were our problems and they stayed behind closed doors and we didn't share them with anyone else. And we really haven't seen mental health be a topic for whole person wellness until more recently, and really pursuing that. And so also talking about how you've educated your parents and helped them kind of come along and been able to really impact generational change, not just in the families that you serve, but also kind of going back to your roots and your family and understanding that from a cultural heritage place as well as a lived experience place.
Absolutely. And when I think of my son's generation, he won't ever have to experience that shame or guilt of saying, hey, I need to talk to somebody. I can't necessarily talk to you, and that's okay. Yeah, I think it's really different now that we see what our kids are growing up with, and what we can kind of do for them is really be able to open those doors and open those avenues. I like to kind of tell people when we have cancer, right? Everybody posts about cancer, they talk about their cancer journey. They don't go to the oncologist and think, oh my goodness,
like, I'm so ashamed I have cancer. I have done X, Y, or Z to get cancer. It really becomes something where we as a community rally around people and say, hey, how can we bring you meals? Hey, how can we support you? Like we wear ribbons, we wear things that really support that, and recognizing that our brain health is just as vital as dealing with a cancer diagnosis, and no more shame-induced than having cancer or having any type of brain difficulty, challenge, piece where our brain is just not perceiving things or receiving things in the same way.
Absolutely, because mental health is considered a pandemic as well.
It's actually I love that you bring that up as a pandemic. It's considered one of the top reasons for disability. I think depression right now in the US is currently the top disability topic. And so really recognizing how prevalent it is as well. So let's talk a little bit about some stats on that, because I think we kind of naturally went into that, and I pulled some stats. I know you pulled stats. I'm not as cool as you, so I won't remember them. So I printed the papers to make sure that I did not mess them up. But some of the stats that we have is about 21% of adults are currently experiencing a mental illness. So when we put that to numbers, that's the equivalent of 50 million Americans.
That's a lot of people.
It's a lot of people, right? And so when we look at that and we're standing in a room, we're in a room of 4 people, at least one person
absolutely
statistically is struggling with mental illness.
And sometimes it's not just one diagnosis, it can be multiple diagnoses.
Absolutely. I think if it was that simple, right, it would be a little bit easier, but there's so many complexities to it. So I love that you bring that up too. 15% of adults had a substance use disorder in the past year. So now we're talking about 36% of the population are getting some kind of diagnosis. Now, some of that can be what we call comorbid, like you said, where they're coming together. But the stat that hit me the next right after that one on the substance use is that 93.5% of those people who are experiencing a substance use disorder didn't seek treatment. They didn't receive treatment.
That's sad.
It is. And I think that's kind of, as we talk about awareness, how do we talk to those 93.5% of the population that in those categories were struggling and never received the treatment that they needed? And how do we change that?
I think a lot of it does come from psychoeducation, but also validation and helping them challenge some of those unspoken rules or stigmas that they grew up with, right? When I think of substance use, it is something that's almost kind of looked as, well, you did it to yourself. So there is no empathy. And that's not necessarily true. You don't just wake up and become an addict one day. There's another issue that you're trying to treat through that substance use.
Yeah, I love that. I think that it's really understanding that substance use isn't something that people are just stepping into, right? It's something that they're actually trying to cope with what's going on within them. And then that coping mechanism turns and is no longer helpful and actually becomes destructive. And so realizing that it's a failed attempt to get support, not necessarily a character flaw or a chosen path of quote unquote failure.
Absolutely.
Yeah. You brought up culture earlier, and this stat kind of sticks out to me. 11% of adults who identified with 2 or more races reported serious thoughts of suicide.
I know culture is very important to me because my parents are immigrants. So I'm first generation American. And in my graduate school, I did a lot of research on how first generation experience a lot more mental health illness than their parents, because the acculturation here is so challenging. You're coming from a American society where it's kind of normalized, it's talked about, where maybe in my parents' country of origin, prayer was seen as the only resolution for a lot of these issues. So I wonder if that speaks to some of that.
Yeah, I think it does. I think when we understand that we live in a very complex world and fitting in can be very challenging, especially when we really think about who we are. We were born to stand out, but we're designed to want to be in community. And so when we have a lot of variations in terms of like how we present and those unique pieces, it can sometimes be hard to live with that exciting uniqueness that's us and see that as the gift that it is, when oftentimes it's experienced as something that is maybe like your friend was bullied for or rejected for, as you kind of bring up, like that acculturation, like figuring out how to fit into something that you were never designed to fit. We needed to adjust and make our culture something that's a lot more accepting versus rejecting.
Absolutely. Like when I think of emotionality, I think in the past I viewed my emotionality in a very shameful, negative way, but I've been able to turn it into a gift and bless other people with that empathy that maybe other people viewed as a weakness. I love that you bring that up, because you are all heart, right? And I think that anybody who gets the privilege to know you gets to know that you love wholly and fully from your whole heart. And so you get to experience that, and assuming that needed to look different for other people. I love that you're saying, like, I've been able to embrace that as its own gift. Absolutely.
When we look at a couple of these other ones, I wanted to kind of bring up a little bit about youth. Like 60% of youth with major depression don't receive mental health treatment. So I think sometimes when we look at the adult statistics of 21%, right, we know that those statistics are significantly higher in youth. Can you speak to that maybe a little bit on what you've seen on the clinical side?
I think with my teen clients, what I tend to see is they will trauma bond. I have depression, you have depression, let's be depressed together. And they maybe seek out information that isn't necessarily accurate on social media. They self-diagnose. But again, there's almost this like secrecy to it of we shouldn't talk about this with anyone. Or again, with their parents, right? What are their parents' experiences with mental illness? Are their parents someone that they can safely talk to, ask for help, or do they just invalidate themselves the way that maybe their parents have kind of modeled?
I like that you bring that up, because you're talking about trauma bonding, which for people who are listening, they may not know what that means. And that really means like coming together and we really connect over our shared lived trauma or experience. And so it becomes this like bubble, right, of this constant like discussion about the trauma, and it becomes very isolative.
Absolutely.
And so what I hear you saying is that isolation, now you have two people who are hurting and struggling and very little input from the outside world. And so it becomes this place of hurt people hurt, right? So it's good while it works, but when it doesn't work, it becomes really hurtful. And then when it's really hurtful, now you have this cycle of hurting.
And that's why therapy is such a great intervention, because it's an unbiased perspective.
Yeah, I love that you bring up therapy too, because I was looking at one of these other statistics and it says, and it kind of like almost, hit me at the core. It says the average delay between when the symptom onset starts and when treatment is received is 11 years. Like, can you imagine, like, when you see that, right? Like, if we said, hey, I think I have this lump on my breast, right? But I'm not going to seek treatment for 11 years.
At that point, it's almost the preventative work that can be done.
Right? And for us to be able to see like how prevalent this is and how challenging it is. And we would never look at somebody who has a lump and go, why did you go to the doctor?
Right.
That's a terrible idea. But when it comes to mental health, a lot of times we do have that same kind of, a lot of times people can come with that approach. And I know our heart is to really like cut down that 11 years and to really make sure that people are seeing therapists as real people.
Absolutely.
So one of the things that we've had the privilege of doing together that I think speaks to a lot of mental health awareness is we often are out in the community, and you and I have had the privilege of doing Rio Rancho Sunday is Fun Day, which is this big community event, and we've had a booth for, I don't even know, a lot of years. Right? And so you were with me when we were doing the first booth. Can you speak to that a little bit about like kind of what we saw in those like early years being out in the community and kind of trying to talk about mental health awareness, or at least just be like, hey, we're we're real people too.
Definitely. I mean, I laugh because it's changed in the last couple of years. Just our presence in the community. In the beginning, they would, walk around the booths, see the different, freebies, things like that. And then they would see our booth and it would say mental health and they would walk the other way.
Yeah. I was like, do we smell? Like, is there something happening? Like they would go all the way to the other side of the aisleway just to like not catch our mental health cooties or whatever was happening.
Absolutely. I mean, even just to get to the bathroom, they take the long way. It's like, what did we do? So it's been nice in the last couple of years just seeing people come up to us and have questions, even, start referrals right there on the table or ask for resources that they can take back home, bring to their children's school, even get to know like a potential therapist that they might get to work with. It's just been more eye-opening to see we really are changing that stigma of mental health.
Mm-hmm. I think it's really getting to see therapists as real people too.
Oh yeah.
Right? I think there's some new shows that have come out that depict counselors. One that I think on Netflix, I think somebody got kidnapped. Very scary, terrible, right? I think that was a Steve Carell one. But I think it's really like starting to see that therapists are real people.
Absolutely.
And the very first therapist you meet may not be your best fit, but finding the right fit for you and the person who really resonates and you connect with.
Yeah, it's like dating.
It is. Tell me more.
Well, when I think of even my personal experience in therapy, it hasn't been until my current therapist that it's been the right fit that I've stayed with. Historically, when it's not a good fit, I tend to self-sabotage. Whether that's I stop coming to appointments or I don't participate or I tell myself that I'm magically healed. And that doesn't serve me. So being honest and saying, hey, your approach isn't working for me or talking about my feelings in this way doesn't really make me comfortable. So just not being afraid to advocate of this isn't going to work and how can I, continue to explore for the person who can support me. I know through any intake that I do with a new client, at the end, I end with, do you think we're going to be a good fit? It's not going to hurt my feelings. What matters most to me is that you're in services. And if I can't provide those services, I'll find someone who can.
Mm-hmm. I love that. I think it's that idea that not every person that we meet with and we're going to connect with is going to be our person for that long-term journey or even the short-term journey of getting that help. And so really going in, discerning and realizing like if this provider isn't the right fit for me, then I have options to choose someone else that is the right fit for me. It doesn't make them bad. It doesn't make me bad. It just means that we have different visions and we just don't click, and that's okay.
Absolutely.
So the other piece of mental health awareness, like we've talked about kind of raising that support and like really challenging the stigma. We've talked about that understanding. I love that you bring up like understanding ourselves, right? Like really understanding who we are and seeing those things that we maybe saw as warts before and seeing those as gifts, right? They really are gifts. They're part of how we were uniquely created. And then really making sure that we have access to resources. So when we think a little bit about the access to resources, tell me a little bit about being in the community and what it's like to access resources for support.
I mean, I know in New Mexico, there's definitely a shortage. That's just the kind of state that we live in where we don't have access to quality services. But I think a lot of it comes down to just research, right? Maybe it's reading the reviews or asking for a referral of somebody who maybe has obtained services there and what was their experience like. I don't know if that's necessarily answering your question.
Yeah, I think it's resources, right? Like it's being in community. I love that part of that piece of asking for help and support is willing to take the risk, right? And realize that we wouldn't go like, gosh, I feel really bad asking somebody about their oncology experience, right? We would say like, yeah, absolutely. Let us know. This is who like really helped me in this journey. And so really being able to open up some of the dialogue with people around you to say, hey, I'm looking for support services. What are my options?
Absolutely.
The other piece that I think about is there's a lot of misconceptions around accessing resources that I think kind of perpetuate stigma. Let's kind of talk through some of the funny things that you've maybe heard about like mental health, and let's kind of like myth bust the stigma that maybe has happened.
I know a lot of my clients will come in and saying, oh, I don't have to lay on the couch.
Yes, right? Like we do have couches.
They're very comfortable.
They're usually comfortable. Most of the time you're upright, but you do you.
Yeah, feel free to kick off your shoes. I do sometimes.
Yep. So not going to lay on the couch necessarily.
Not unless you want to.
Not unless you want to. There's choice. What other stigma or things do you think kind of come up?
That every time they talk, my response will be, how does that make you feel? I don't think I've ever said that once.
That's so true, right? Like, how do you feel about that?
Well, not good. That's why I'm here.
Yeah, not great. So we talk about feelings, but maybe not in the way that you weirdly think about them coming out.
Yeah, we help you explore them.
Mm-hmm. So what other myths do you think might come up?
That you just kind of nod. You don't really talk much. They do all the talking.
Yeah, I remember in grad school they said that and I was like, oh dear, I gotta quit. Like I'd never not talked. This is gonna be terrible. And so it really is this dance of listening and giving feedback and reflecting back. But it's not something where it's this like blank smile and nod and we don't give any feedback or talk at all.
Right. It's warmer than that.
Yeah, much warmer, right? It's like a real conversation.
Absolutely. Because like you said, we're real people. Or when I think of the biggest one, sometimes I appropriately self-disclose that, I'm in services myself. And sometimes my clients' reactions are like, wait, really? I'm like, well, yeah, why would you go to a therapist who's never experienced therapy?
Right. If a therapist is really like excelling, they're doing their own work so that they can be the best instrument to help the people that they have the privilege of serving.
Absolutely. So just normalizing that even your therapist as a therapist.
Mm-hmm. Absolutely. They reinforce it in grad school. In fact, our code of ethics strongly encourages that and being in consultation. What other stigmas do you think come up?
That it's almost a sign of weakness, just to be in there, to express whatever it is that's bringing you to services. I know I have a lot of clients who they'll start with, oh, it's not a big deal, but this is what happened. And I immediately have to redirect and challenge that invalidation. No, it is a big deal. It was a real experience. It did impact you. Tell me about it. It's not... You're not going to get the same response that you get from other people of, yeah, get over it. Pull yourself up by the bootstraps.
I love that. So it's this myth piece of I should just be okay with everything that's happened, or it's not that big of a deal. And recognizing that our brains actually do see it as a big deal. And I think that that's one of the things that I love to talk about with my clients is they'll say, it's not that big of a deal. And I'll say, well, your brain sees it otherwise. And if I were to put you in a functional MRI, it would light up to tell me that it is a big deal because your trauma receptors are lit up and they're activated. And so it is a big deal. Whether or not other people agree with it, your brain sees it as a big deal, and therefore, it's a big deal.
And your therapist sees it as a big deal. So how do we help that internal empathy and support for yourself?
Yeah, so really developing the skills to validate ourselves and then to really acknowledge the experience, because once we acknowledge the experience, that's actually what calms down our brain, which I think is one of the other myths, right? If we acknowledge it, then our brain is gonna ramp up and it's gonna make it that much worse. But what we see on brain scans is once we acknowledge it and we validate it, our brain actually goes from a heightened state of arousal to a more normalized place where it's like, okay, that was a tiger. The cat looked like a tiger, right? And it had the characteristics of a tiger. It appeared like a tiger. I experienced it as a tiger. Okay, here's how to deal with it. And then it can let itself rest versus be in a state of constant, oh my goodness, are we in the jungle? Where's the next tiger coming?
Yeah, the intensity decreases, so you feel a level of safety to do that work. If you would have asked me 11 years to tell you why I wanted to be a social worker, I would just start crying.
Yeah. And seeing that crying, though, was again, part of the progression to what's got you here.
Absolutely.
It was strength, right? And I think when we talk about that myth that mental health is negative or it's a sign of weakness, what I really like to highlight is seeking services for mental health is a sign of strength and courage, because it's really hard to face the things that we think in our head or the experiences that we've had. And it takes a lot of courage to do that.
Absolutely. And it should be celebrated more.
Absolutely. The other thing, let's kind of go through a couple other funny mental health stigma busters. Anything else that you can kind of bring up?
I think just the idea that we're perfect.
Oh, I know. Well, no, I don't. In this room, I'm a very different wife than I am outside of this room.
Oh yeah, I struggle with emotion regulation at home.
Right? Like, I think that we're perfect. Nope, we're
Hot Mess Express.
Yep, Hot Mess Express. We are humans, and we're here to walk alongside it with you. And we don't have all the answers, and by no means are we perfect. And we definitely don't have the therapist speak, quote unquote, that I think people, how do you feel?
Yeah.
Right? That deep, intense, like longing look, right? Like, I'm looking into your soul. Like, no, we're just real people having conversations and learning with you about how you think to help you. Any other ones that you kind of come up with?
Maybe that we're judgmental.
Oh, I love that one. Tell me more.
Just that they're hearing, oh, this is what I did, or this is my past, and you're immediately judging me or viewing me in this negative light. When you brought up code of ethics, if you're judging, you're in the wrong business. That is not at all our heart.
Yeah, I think it's this idea that like there's some kind of evaluation, right? Like I'm evaluating you or judging you, or I think of labels, right? Like I'm labeling you with this and you're putting me in a box. You know, a really good experience in mental health is about taking those labels not as, you know, a name tag that we're wearing, but really like, okay, how does that show up for you? Tell me how anxiety might show up for you. How is it impacting you? And it's not about us labeling, it's about giving tools and resources for people to say, hey, like I feel really emotional. I need to use some of my emotion regulation skills.
Absolutely.
Yeah, I had an experience this week where I was in a doctor's office with my daughter, and it was very interesting to me because we were talking about mental health and very much that kind of old school mental health stigma belief of like, well, I'm not going to label you. That label will follow you for the rest of your life. And it's really that idea of like, if I had strep throat, would you be afraid to code my chart with like, I have strep throat? Like, I am not strep throat. Like, I am not anxiety, right? Like, I am me. And that is an example of what's happening in my life right now. I might have strep throat. I might have anxiety, but this idea and the stigma that those labels are going to follow us forever and that we're never going to be able to shed them is just not true and is so old school that I think that's one of the ones I always want to try to myth bust when that comes up.
Definitely. It's part of your narrative, but it's not your identity. I think the identity is that resilience that you've been able to develop through your hardships and your experiences.
Yeah, I love that resilience piece, right? Like I had strep throat, I took antibiotics, I gargled with salt water, I got better, right? I had anxiety, I learned coping skills, I became incredibly resilient, and now I can be an advocate for people in my community who might have similar experiences.
Absolutely.
So the other piece I think about when we're talking about advocacy is like the power of allyship. Can you speak to that a little bit and how much that means to you?
Do you mean as far as allies like within the community or just like internal support systems?
I think both. Let's speak to both because I think allies show up in lots of different ways.
Well, when I think of like my internal support systems initially, right, they weren't supportive because they didn't understand. But through that psychoeducation, like I see them being advocates for mental health. Whether it's, hey, you know, here's a business card. My daughter works here with wonderful people. It sounds like your person would benefit from this. Or my husband has one of our TFC shirts. He wears it out in the community. They ask him about it and he explains, you know, this is a outpatient mental health agency. Like give them a call if you're struggling. The people there are good. Or even when I think within the community, I have colleagues that I went to school with or maybe used to work alongside me. They, you know, have developed their own practices or different communities that they serve now, and being able to call them up, hey, I'm looking for services for this client. Or when I think of like bilingual services, I don't know many bilingual therapists. I think within our agency, it's me and maybe two other providers. So being able to go out and know, like, I know this person, call them, see what their availability looks like. Because what matters most is you're being served. It doesn't matter where, just you're being served.
Absolutely. I think that that's one of the really exciting things about mental health is that it really is an ally within the community, both local, like we can be allies with each other or with people within our family to help support that. Other people can kind of come alongside us. And then we can also be allies within the community, that there isn't a competition,
No.
right? In my perfect world, like we would nobody would ever need our services because we would be so healthy that we would have no other choice but to, work as baristas or something. I don't know. But it's really this idea that there is a community, and in that community there are resources, and making sure that we're accessing those and that we're staying connected to a lot of different people, because again, we're not going to be the fit for everyone. So the other piece, one of the things I'd like to kind of talk about is a little bit of like a successful story of what it looks like to maybe, if you've had somebody come alongside you, or you've been able to come alongside somebody else, and how that allyship or how that support has maybe impacted or changed a trajectory for someone you know or love, or for yourself, if you'd be willing to share something like that.
Well, I think of a couple clients that I've had in the past that they came in, not feeling very resilient or strong, a lot of shame and guilt, a lot of unresolved trauma that's just really stunted their growth and their healing. And through our work, they've been able to find, that strength that you were talking about earlier, and being able to discover their own passions. And surprisingly, they've gone into the mental health field because of their lived experiences.
I think that that's a really great example of talking about how somebody has been healed, and then kind of like you, that drives that passion for them to be healed, to be healers as well, right? And I think for me, that's very much a part of my story, is growing up in, some challenging environments, and really learning how accessing services the way that I did when I was a kid, how much that impacted how I wanted to make sure I offered services when I became that professional. And so a lot of what I hear is that when we think about health and we think about mental health, it really is this whole person, holistic developmental process. It tends not to be like a one and done. Like I went to therapy that one time.
Yeah, it's a long journey.
Yeah, it's kind of like I went to my primary care that one time. And ever since then, I've never been back.
You got to keep feeding it.
And I think we're different, right? And what we need comes at different phases in our life, and it helps us be more resilient. And accessing services, again, doesn't mean that we've failed.
Not at all.
It means that we're just at the new phase of like uncovering and discovering something new about where we're at and how to get to where we want to be.
Yeah, I think when I discharge clients, I always tell them, you'll need therapy during different seasons of your life, and that doesn't mean you weren't ready. That doesn't mean you failed. There's different experiences, different hardships that you're having now, and you recognize it because of the work you've done, and you're just coming back for a tune-up, kind of like when you take your car in for an oil change.
I love that tune-up. And that tune-up may not be the same mechanic every time.
Exactly.
Right?
Or the same amount of time, right? Instead of a year worth of services, 6 months and you're out.
Really being able to access that. And so when we think about policy change, if you had kind of your magic wand and you could change policy in any way, what would you see? What would you change to be able to increase that mental health awareness?
Oh, that's a good one. Well, I think within our state, I don't know if it was last year, just some insurance companies, right? They've been able to cover mental health services at 100%. I know early on, that was the biggest barrier for me going to services. I can't pay $30 every week, but my therapist says I need to come every week. And now most insurance companies, $0 copayment, deductible, there's no excuse.
I love that. So that kind of policy change, I remember joining the field when mental health was considered like an added benefit, right? Like if you got to have mental health care services that were covered by your insurance, it was like a special part of the plan that was above and beyond. Now with mental health parity, one of the things that we want to talk about is that mental health coverage is accessed and can't be any more discriminatory than like accessing physical health. So you have that covered under your plan, right? Under health insurance. And then a lot of things that changed is there's really this strong push towards $0 copays, meaning that every time you go into that appointment, you're no longer having that barrier of financial restrictions, maybe, where that makes it difficult to access services. It's not that way all the time, but it's definitely moving in a better trajectory where there is less cost up front for mental health services.
And I think the insurance companies are also starting to recognize, right? Oh, services work. So we're going to keep paying for this.
Yeah, it's huge, right? Like they save they can pay almost an entire year of therapy, and that's like way cheaper than just one ER visit. And they're starting to realize like not only does it matter to the quality of life, right? But it really matters in dollars and cents to people as well as insurance companies.
And back to like that mental health stigma, I think the insurance company, that's a good way to, see that it's not a, taboo, or it's not in your head. It's not a luxury. It's something that everybody should have access to.
I love that. I think that brings me to kind of one other thing I think about when we're talking about like being discerners of services, right? Like when we meet somebody and we access that service and whether or not we decide to stay or we decide to move on. One of the other things that I kind of think about there is, are we setting goals with our therapist, and are we checking in on those goals quarterly to make sure that we're making progress towards being who we want to be and working on building those skills?
Right. I think when you were talking about like misconceptions of therapy, it's, I just go in and talk and vent. Not necessarily, right? Like, yeah, I want to hear what's going on and validate it, but what are the goals? Because therapy shouldn't be a lifelong commitment. It's something that you need during different seasons. So what goals are you working towards achieving so you can monitor or manage some of these symptoms, these stressors on your own?
I love that. Therapy, like when you say not a lifelong commitment, right? It is a commitment to doing therapy throughout your entire life, but it may not be a continuous process of doing therapy throughout your entire life because you're building skills and you're learning how to understand yourself and how to manage things that are happening within your life so that you feel a sense of empowerment. And I think that's a really big part that I hear your heart in, is that empowerment and making sure people know that as they're accessing these services, like their voice matters.
And that they did that work. I think sometimes clients will say, I couldn't have done it without you. You did all the work. I was just alongside you.
Yeah, I was just a co-pilot here. You're the driver, and I might give you some directions, or I might tell you, here's where traffic's coming up. But ultimately, like, I've taught you, like, I've helped support you on how to learn how to drive so that you don't need me as your co-pilot. Like, you've got this. And really recognizing that it's not about us as the therapist, it's really about that particular person that we have the privilege of serving.
And then that empowerment continues to support dialogue about mental health awareness and challenging that stigma. Don't talk about it. Keep it, private. Oh, don't tell anyone but your family. No, doesn't serve me.
No. So I think let's go through like a couple things that we would want to say about mental health stigma, maybe like statements that we would want people to like resonate, or mantras that we would want them to maybe sit with for a little bit longer.
Do you want to go first?
I was kind of thinking of things like you matter, right? So when I think of like talking about mental health, like what I would want to tell somebody who's struggling is that you matter. What you're going through is valid. You're worth healing.
I think of there's no shame, just that statement alone.
There's no shame. That's so powerful.
When I think of like time, the time frame of it, don't prolong it.
Start now.
Start now. Take control. Yeah, even think of change. Empower possibilities.
I love that. I think that piece of like empower possibilities, know where you are growing and you are capable of that even when it doesn't feel like you are.
I even think of a sticker I have on one of our TFC water bottles. It says, growth is not linear.
Oh, I love that. That idea that growth is not this like beautiful, like incline up. It's this like roller coaster of hills and valleys. And over time, you're making it up a little bit further than you thought, but it's still, I think it's it's circular, right? Like
Oh,
there's
yeah.
a lot of like coming back to some of the things, but going at a deeper level.
Mm-hmm.
The other thing I wanted to kind of say is, as we talk about mental health, I wanted to kind of finish talking a little bit about suicide and the thoughts of suicide and kind of normalizing a little bit of those thoughts. And then also just if you're somebody who is struggling with thoughts of suicide, to know that you're not alone and that there are options and there are hope, even when it feels like there's nothing left, that you have nothing left to give, you have nothing left to share, that you really matter and your presence on this earth matters. So when we think about suicide, what are some things that you would kind of want to normalize or myth bust about suicide?
If you talk about it, it's going to happen. I think that was the biggest one. No, don't talk about it. Don't tell anybody about that story, because then other people are going to think about it. That's not true at all.
Yeah, this idea that if we just start talking about suicide, then all of a sudden everybody's going to start talking about suicide and it's going to catch on and we're not going to be able to do it. And really what we know from research and lived experience is that the more we talk about it, the more we bring it out to light and the more we normalize it, the more that we actually have success in keeping people alive, that shame grows in darkness, right? And so much of suicide is rooted and suicidal thoughts is rooted in shame, that it really it breeds in darkness. And so we really want to bring it to light, having conversation, having dialogue, and not being afraid to be real with people.
Absolutely. I'm glad you bring up the shame aspect of it, because I think that's the biggest issue with suicide is you keep it bottled up, and that suppression is so dangerous.
So dangerous and so toxic, right? I think it really is taking this toxic thought and then just kind of really holding it in. And then as it continues to stay held in with shame, it's growing and it's multiplying to where now what was this big has now become this snowball, and it feels really overwhelming. The other piece I think about when I think about suicide and the thoughts of wanting to die is how common it is.
Absolutely. We've all been there.
That we've all really been there, right? Most of us have had those thoughts. And statistically, we know that to be true. And so really recognizing that part of that is our brain's fight or flight system, right? That when we kind of drop down into this place of I don't feel safe, we really have 4 options available to us, which is fight, flight, freeze, and fawn. And that flight is I can't do it anymore. I'm tapped out. And so to really recognize that having thoughts of wanting to die is not a bad character flaw. It really is a normal part of coping through really tough situations. And what we want to do with that coping is we want to bring it to light. We want to have dialogue, and we want to be able to share that with other people who can come alongside us and say, let's talk about that a little bit more. You matter, and what's going on that's bringing you to this place. Anything else that you would add to that?
I don't think so. I think you've covered it. I think, again, it's just the not having that fear to bring it to light. Because we weren't meant to be in this world alone. So help yourself by carrying that burden with someone's support and just knowing that, I've been there too. And I got better when I started talking about it. I started acknowledging it.
I love that. It's that courage piece, right? Taking the risk and knowing that risk is way less toxic and more gratifying than keeping it bottled in. And I think being willing to take the risk more than once, because we might share it with somebody who doesn't know what to do with it, or maybe even doesn't handle it well.
Absolutely.
Right? Just flat out drops the ball, right? And not letting that be the deterrent for us trying again and continue trying until we get the support and help that we need. So as we finish up today, I really just want to say thank you so much for joining today's episode of TFC Talks. Thank you, Renee, for sharing your wisdom and your experiences. You bring so much value to our community. I think it's been a privilege for me just getting to do life with you and watching you bring that passion for mental health awareness through everything that you do. And so I want to remind everybody that mental health awareness isn't just a conversation, right? It's not a one-time thing. This is a movement. It's a movement towards positive change, and we need your help to be our ally, to join alongside us, to bring this dialogue to the forefront so that nobody is suffering in silence. And so if you can follow us on Instagram at tfc.health, share your thoughts on today's episode, share this episode with somebody you love, or maybe somebody you don't love, but you know that they need it. And really make sure that as you're joining us today, that you're really recognizing where your mental health is at. Right? We all have mental health. And so it's on a continuum of healthy to unhealthy, and really asking yourself where you're at, and then evaluating those that you love to see where they at on the spectrum of health, so that you can come alongside them if maybe there are some things that need a struggle. So until next time, take care of yourself and each other. Thank you so much.